Nafarelin spray, non-aerosol, is used to treat endometriosis in women, which is a condition where the tissue that normally lines the inside of the uterus grows in the wrong place. This medication helps to decrease the abnormal tissue and the symptoms of endometriosis, such as pelvic pain, painful menstrual cramps, and pain during/after sex. It is also used by children to treat a certain type of early puberty, central precocious puberty, gonadotropin-dependent, to slow the bone aging and height growth rate so that both are near normal, and to stop or reverse signs of early puberty, such as breast growth in girls and growth of sexual organs in boys. Nafarelin is similar to a natural hormone made by the body, gonadotropin-releasing hormone-GnRH, and works by decreasing the testosterone hormones in boys and estrogen hormones in women and girls. The daily dosage and optimal timing for taking this medication should be determined by a healthcare professional. Before using Nafarelin spray, non-aerosol, make sure to read the medication guide and the patient information leaflet provided by your pharmacist. It's important to follow the illustrated directions for the proper use of this medication. If you have any questions, don't hesitate to ask your doctor or pharmacist. It's recommended to do a test spray in the air if you are using the bottle for the first time. A fine mist indicates that the spray is working properly. Before using the medication, gently blow your nose. For young children, it may be necessary to clear the nose with a bulb syringe. Use this medication as directed by your doctor, usually twice daily, about every 12 hours. If you are using more than one spray at a time, wait 30 seconds between each spray. Avoid spraying this medication in your eyes and try to avoid sneezing during or right after using it, as this may decrease the amount of medication absorbed. It's important to follow the detailed instructions for cleaning the spray tip and to clean it after each use. The dosage and length of treatment are based on your medical condition and response to treatment. It's crucial to continue using this medication exactly as prescribed by your doctor. Do not skip any doses and try to use it at the same times each day to help you remember. Make sure to ask your doctor or pharmacist how long each bottle of the nasal spray should last. Do not use the nasal spray bottle longer, even if there is medication left over, because you will not get a full dose. Also, make sure to get your medication refills a few days early so that you will not run out of your medication. Do not increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. If you need to use a nasal decongestant spray while using this medication, wait at least 2 hours after using this medication before using the decongestant. When you first start this medication, worsening of symptoms may occur, such as increased vaginal bleeding for women treating endometriosis, or vaginal bleeding/period, increase in breast size/pubic hair, oily skin, or body odor for children treating early puberty. These symptoms should get better after the first month of treatment. Tell your doctor if your symptoms do not get better or if they get worse after 2 months of treatment. Some side effects may occur in children, such as nasal irritation, hot flashes, or vaginal discharge. In women, side effects may include nasal irritation, hot flashes, headaches, decreased sexual interest, muscle pain, vaginal dryness, acne, or decrease in breast size. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. If you experience any of the following serious side effects, it is important to inform your doctor immediately: mental/mood changes, such as depression, thoughts of suicide, mood swings, or aggression. For women using this medication, serious side effects may include abdominal/lower back pain, bone pain, fast/pounding heartbeat, numbness/tingling of arms/legs, or eye pain. In the case of very serious side effects such as seizures, increased pressure around the brain in children, or a severe allergic reaction, it is crucial to seek medical help right away. This may include symptoms such as severe headache, vision changes, or trouble breathing. If you notice any other effects not listed above, it is important to contact your doctor or pharmacist. Before using Nafarelin, make sure to inform your doctor or pharmacist if you have any allergies or medical conditions, such as abnormal vaginal bleeding, smoking, alcohol use, bone loss, polycystic ovarian disease, high cholesterol, seizures, or mental/mood problems. Also, let your doctor or dentist know about all the medications and products you are using before having surgery. This medication should not be used during pregnancy as it may harm an unborn baby. Women should start taking this medication between days 2 and 4 of their period. It's important to note that this medication does not serve as a reliable form of birth control, so it's important to discuss non-hormonal forms of birth control with your doctor. If you think you may be pregnant, inform your doctor immediately. It's not known if this medication passes into breast milk, so it's best to avoid breastfeeding while using this medication. Be sure to consult your doctor before breastfeeding. It's important to be aware of the potential interactions that Nafarelin spray, non-aerosol may have with other medications. This could impact how your medications work or increase your risk for serious side effects. It's recommended to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, this medication may interfere with certain lab tests, such as tests for pituitary gonadotropic and gonadal functions, potentially causing false test results. It's important to make sure lab personnel and all your doctors are aware that you use this drug. If someone has taken too much Nafarelin spray and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It is important to act quickly in these situations to ensure proper medical assistance. It's important not to share this medication with others. Your doctor may need to conduct lab or medical tests, such as monitoring growth and bone age velocity in children, while you are using this medication. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. It's important to note that girls and women who miss doses of this medication may experience vaginal bleeding. Be sure to take your doses as prescribed to avoid this potential side effect. When you have Nafarelin spray, non-aerosol, you should store the bottle upright at room temperature, away from light and moisture. Make sure not to freeze it or store it in the bathroom. Keep all medications away from children and pets to ensure their safety. When it comes to discarding the product, make sure not to flush it down the toilet or pour it into a drain unless instructed to do so. Always properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. It's important to take care of your medication and properly dispose of it when necessary to ensure the safety of those around you. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.